What is the best test for diagnosing bladder cancer? Have you ever wondered what the best way to diagnose bladder cancer is? Diagnosing bladder cancer is not a one-size-fits-all process. Several tests are available, each with its own strengths and limitations. The choice of the best test often depends on the individual's symptoms, medical history, and the stage of the disease. Typically, the first step in diagnosing bladder cancer is a urinalysis. This test checks urine for blood or abnormal cells. While it can indicate the presence of blood, it is not specific for cancer. Following this, urine cytology may be performed. This test looks for cancer cells in the urine and is more specific than urinalysis, but it can sometimes miss cancer if the cells are not present in the urine. Imaging tests like ultrasound, computed tomography scans, or magnetic resonance imaging scans can also play a role. These tests help identify tumors in the bladder and assess their size and location. However, they are not definitive for diagnosing cancer. When it comes to advanced diagnostic tests, the transurethral resection of bladder tumor, often referred to as TURBI, is significant. This surgical procedure removes a sample of the tumor through the urethra. It serves both diagnostic and therapeutic purposes, allowing for the removal of non-muscle invasive tumors. A biopsy, which involves taking a tissue sample from the bladder for microscopic examination, is the most definitive way to diagnose bladder cancer. Emerging technologies are also being explored. Research is ongoing into blood-based tests that could detect cancer biomarkers, offering a non-invasive method for early detection. However, these tests are still in development and not widely used for bladder cancer diagnosis. Genetic and molecular tests can identify mutations or markers associated with bladder cancer but are primarily used for treatment planning rather than initial diagnosis. In practice, the best approach often involves a combination of tests to confirm a diagnosis and assess the extent of the disease. Regular follow-up care is crucial, especially for monitoring recurrence in non-muscle invasive bladder cancer. While there is no single best test for diagnosing bladder cancer, combining urinalysis, imaging, and biopsy, particularly TURBI, provides the most accurate diagnosis. Always consult with healthcare professionals for personalized medical advice tailored to individual circumstances.